So I'm actually going to be talking to you a lot about what you heard from Marco. So I'm going to talk, but I'm also going to talk about patient utilization a little bit. So 3 things I'm going to talk about. Are we hitting our Healthy People 2020 targets for patient utilization? Because that sort of helps us quantify, how well are we doing, because that's the bottom line. Do we have workforce shortages? And how many patients are dentists seeing? This I can look at in the context of medical assistants. So one of the bottom lines of my presentation is we do not have, in this state, the data to be able to answer these questions. Okay, so this is a problem. I cannot give you a complete answer to these questions. The best I can do is have an imperfect solution, which is to use medical assistance data. I'm not picking on medical assistants, but medical assistance has data that allow me to address these issues. Okay? But what that means is that there's some caveats. Medical assistance covers only 20% of the population and a subset of the dentists in the state. So the results that I'm going to show you don't reflect completely what's happening. It doesn't include the commercially and the uninsured people. This is not a complete picture. Okay? The data that I'm showing are people who are eligible in calendar year 2015, even if they were eligible for only 1 day or they never even enrolled. They were eligible but unenrolled. I'm also doing this at the county level, and I think as has come out in some of the presentations, the picture may be different at these sub-county levels, like transportation issues, for example. Okay? So please do keep these caveats in mind. So my first question is, are we hitting Healthy People 2020 targets for patient utilization? Okay? There are just 2 things I want you to take from this slide. The Healthy People 2020 target is 49%. That would show up as blue on this map. As you can see, there is no blue on this map. That means that in no county for adults are we hitting the 2020 Healthy People target. Okay? What I also want you to notice, however, is that there's a fair amount of variability from county to county. Okay? It doesn't really show as yellow. Yellow is, just to give you a sense, is 11 to 20%. I know it's hard to read the key. Okay? Okay. That was adults. This is children. Okay? Again, our target is 49%. Shows up as blue. Forest County is in blue. They're actually they're quite close to the target. Okay? None of the other counties is hitting the target, but again, a lot of variability. Okay? Now, since this is a workforce summit, I'm looking at workforce explanations for these results. It should be noted, though, that there are many factors other than workforce factors that influence utilization. Okay? So do we have a workforce shortage? So this is the number of general dentists accepting medical assistance per 5,000 MA-eligible adults. Okay, that's the definition of a shortage, is 1 FTE dentist per 5,000. Okay, so white means that there is no dentist there. It's less than 1 per 5,000. So you can see that there is no white. Okay, so there is no shortage, not in any county. But again, there's a lot of variability. Okay, that was for adults. This is for general and pediatric dentists. For children, again, no white. So no shortage and a lot of variability. Okay. So now because I'm looking at MA data, I can actually ask the question, how many patients are MA providers accepting? Okay. So this is a little different. Okay. Okay. So this is for adults. And what you're seeing is the median number of MA patients seen. So let's say that there is a county that has 10 dentists. The median number would be that half the dentists are seeing less than this number, and half the dentists in the county are seeing more than this number. Okay? And so I want you to see that there's a lot of variability. I'm a psychologist, and so I think about behavior, and I'm interested in understanding variability in behavior. Okay? So the yellow here, combining the light yellow and the dark yellow, is the median ranges between 1 and 120 patients per calendar year. Okay. This is children. Okay. And here, the yellow is 1 to 180 patients. The median is 1 to 180. Okay. And then this is pediatric dentists. The white are counties where there is no pediatric dentist. So what you're seeing is there are a few places that are really carrying the load. Blue is over 1,600. Okay. So in sum, are we hitting Healthy People 2020 targets for patient utilization? In short, the answer for adults is no. For children, a few counties are close. Do we have workforce shortages? By these data, and by what Marco showed you, and by other data that I've looked at to try to triangulate on this question, the answer is no. Okay. So then we have to think about, well, what are other factors affecting utilization if it's not just the number of dentists in these counties? Okay, that's what I mean by a shortage, just number. Okay, so we also looked at how many patients are MA providers seeing. In most counties, dentists are seeing fewer than 121 MA eligible adults and fewer than 180 MA eligible children per year. So what we observe is that there's great variability from county to county, and that suggests that perhaps the solutions may vary from county to county. Next steps, as I was stymied because I did not have the data that I wanted to be able to address this question, I would really like it if we had an oral health database that includes commercially uninsured people so that we could really understand and get a complete picture of what is going on. And then for medical assistance, I'd like us to sort of spend some time thinking about what are reasonable targets for number of patients to accept. There is no benchmark out there. And I think that if we collectively can come up with some ideas about what we think is appropriate and communicate that and help dentists to achieve that, I think that that might make a difference. And how do we incentivize dentists to accept more MA-eligible patients?